There's a terminology which is often used in a Medica and is a part of the practice. That's a terminology called diathesis. Okay. So diathesis is usually a predisposition towards a certain morbid state. Okay. So there are certain remedies which have different kinds of diathesis. Okay. Now, for instance, phosphorus is especially known for something called tubercular diathesis. Now, what is tubercular diathesis? Means all those people who have a certain constitutional tendency. So now that tendency will have a certain peculiarity which will be visible in their physical aspects which you can observe as well as in their morbid tendencies. Okay? So not currently, but when I was in my college is when I was a lot slimmer. So right now I have a bigger belly, I'm more filled up, but when I was in college I was extremely slim. I did not have flesh on my body, my jawbones were visible, I had a pretty narrow chest. So I remember whenever I would go for the exam for Materia, they would say, okay, explain tubercular diathesis. Okay, because I had sharp features and had a fairer complexion and a narrow chest and tall guy. So they said, explain tubercular diathesis. So, and they invariably, the first thing they would ask me, explain phosphorus to us, because you look like phosphorus, though I'm nowhere near phosphorus. There may be physical aspects, but that's common to all remedies which have a tubercular diathesis. Okay? So that's why there's a very, very famous saying, never judge a book by its cover. Okay, you have to go deep inside and see. So when we talk of phosphorus is extremely well known for tubercular diathesis, but there are many other remedies which show similar tubercular diathesis. Besides bacillinum and tuberculinum, can you tell me any other remedy which has tubercular diathesis? Spongia. Very, very important remedy. So you know, in Alan's keynotes, in the first line as a keynote is given for the tubercular diathesis. Any other remedy? Drosera, very important, has a tubercular diathesis. What else?
Calcareous phos.
Calcareous phos has a tubercular diathesis, and acid phos has a tubercular diathesis, and
CPS.
CPR means not really. Silica, yes, and sulfur has a tubercular diathesis. Very strong remedy for tubercular diathesis. So, besides this,
acid flow
No, definitely not.
so besides a tubercular diathesis which is there, so when you say tubercular diathesis, what you will find is there is going to be an inverted triangular face. The features are usually very, very sharp. So even there's some people who will have put on a lot of weight. You know, like they'll have a big belly. They may have a very full face, yet they'll have a very sharp, thin, pointed nose. When you look at the side, you might see a double chin hanging down, but their jawline will still be visible. Their maxillary bones may still be highlighted. So when the bony ends are more protruding, we consider it tubercular, especially when they have been eating well, when they are nutritiously well fed. Not in people who are completely undernourished or malnourished. In those cases, we do not consider tubercular diathesis, okay, because it's a part of malnourishment. When people come from good families, they're eating well, yet they have that, then it becomes an important feature for us to consider. Apart from that, they may have sometimes what we call a bluish sclera. Okay? So people of tubercular diathesis, besides their sensitivity to respiratory trouble, they also tend to have a weaker bony structure. Okay? And that's why they tend to have a little bluish sclera. Okay? So in which disease Pathologically, do you find bluish sclera? Yes, yes. Okay. So
Use toxin.
okay. So generally, so in tubercular diathesis also you might find that. And then when you look at their back, they tend to have a lot of hair growth on the back, what we call hairy back. Okay, and these people are extremely sensitive to weather changes. Extremely sensitive to weather changes. Now, when you say they are sensitive to weather changes, it means, especially when it comes to tubercular diathesis, the moment weather gets a little cooler, they tend to fall ill. Okay. So, winters are the worst period for tubercular diathesis as well as phosphorus patients. Okay. Mornings and evenings when the temperature is lower is a period of aggravation for tubercular diathesis and phosphorus patients. So morning evening aggravation is an important hallmark of phosphorus patients, especially evenings. Evenings, when we say complaints, especially at dawn and dusk. So especially dusk is phosphorus. But you'll find many symptoms which come up in the morning hours as well. Okay, and any exposure to cold may cause respiratory symptoms, and at the same time, exposure to cold may give them a lot of bone pains, joint pains. So winters are worse for people of tubercular diathesis, especially when they suffer with rheumatic tendencies. Now, people with tubercular diathesis are very similar to people with a rheumatic diathesis. So rheumatic diathesis and tubercular diathesis, symptomatically they are synonymous. Okay, they are different names, but for similar constitution types. Okay, you have to remember that people with rheumatic diathesis also invariably have a tubercular diathesis, and vice versa. But remember, we do not prescribe a remedy just based on a certain diathesis. Okay, we have to go for the finer symptoms to help us distinguish which remedy to prescribe. Okay, then all those areas where the bone is especially right under the skin, those bones are far more affected. And that's why in people with phosphorus, they have a lot of pain, especially in the tibia. Okay? So whenever they have inflammation in tibia or pains in tibia, or people who have, for instance, trophic ulcers developing on tibia, or they have folliculitis developing on tibia which leads to ulceration, or they suffer with little kids who suffer with nightly growing bone pains, they may respond to phosphorus if the other symptoms agree. Okay? And I think, when you look at the osteosarcoma of tibia in our repertory, then phosphorus is the only remedy. That's remedy is mentioned in plain in our repertory, Kent's repertory. All those remedies which are mentioned in plain or printed in plain are the ones which have made an entry on the basis of their clinical efficacy or their purely clinical symptoms. So it's purely a clinical symptom. It was an experience by one physician who at that point of time supposedly treated a case of osteosarcoma. Now remember, you have to put that in a question mark, because at that time the pathophysiological understanding of diseases was quite deficient. Okay? So, but yes, you can say that yes, it has a strong affinity for tibia. Do not take the diagnostic terminology literally. Okay? So, the other thing which phosphorus also has is hemorrhagic diathesis. Okay, which means they tend to bleed more easily and more profusely. Okay, so any injury may lead to lot of bleeding. So phosphorus is also one of those remedies where the patient may continue to bleed after a tooth extraction for a long time, and phosphorus can help that patient recover if symptoms agree. So apart from arnica and hammermillis, this is another remedy that you keep in mind for phosphorus, okay, for continuous bleeding after tooth extraction. Similarly, during the menstrual cycles, the women tend to, especially phosphorus women, they tend to bleed more easily, more early. They have far more episodes of menometrorrhagia. In phosphorus, generally, you will not find phosphorus to be indicated in all those girls or women who tend to have delayed cycles or very scanty bleeding. They are generally having episodes of menometrorrhagia. That means they bleed easily, they bleed more profusely, and they tend to have, in general, early menstrual cycles. Okay? So, that's about hemorrhagic diathesis. The other diathesis which phosphorus contains, can you think of any other diathesis which phosphorus will cover? Any other diathesis? It's called hepatohemorrhagic diathesis.
It's a very rare.
Yeah. So they have a strong affinity on the liver, very strong affinity on the liver. So I remember last time I was visiting the ICU of Medanta to see a patient who had hepatocellular carcinoma, and that had metastasized to different parts of the body, and he went into coma because he had sudden severe hemorrhage in the brain, and they tried to control it with anticoagulants and other drugs, but he was not improving. After going through the entire history and everything, and because his wife had passed away and his kids were settled overseas, there was not much information that I could gather, except from the fact they said that, because he's got hepatocellular carcinoma, unfortunately he's got a complication where he's got a severe hemorrhage, and then he's gone into coma. Situation was getting worse. So just because that he had a background like that, and that he had a hemorrhage in the brain, and what the attendant confirmed that, generally, lately in the few years, she said he had developed a liking for very cold water. So I gave him phosphorus and he recovered and came out of quickly the comatose state. But as soon as he came out of it is when the kids shifted him back to another hospital, and thereafter I could not treat him further. But yes, what I do recall is when he was not responding to the conventional medicine, he did come out of the coma faster, because phosphorus has a very strong hepatohemorrhagic diathesis. So it's purely what we call the entire pathological general of a phosphorus. Okay, so a lot of these generalities and tendencies are what you'll find in Cyrus Maxwell Boger's general analysis. It's also available online if you ever look at it. A little difficult book to understand, but one of the most excellent books to, if you know your material, to apply your clinical practice. And this is where he extends the scope of generalities into the level of pathology as well. And we all know from the toxicological data that it does produce a toxic effect on the liver. So, the prescription was purely based on the concept of diathesis with one concomitant which I could gather from the patients. Any other MD which has a hematohemorrhagic diathesis that you know? Arsenicum may have features somewhat like that, but I will check. Protalus oilis, very important remedy. Carduous is another remedy which has that. Leptandra is another remedy which has hematohemorrhagic diathesis. So, a lot of times when you see people with advanced pathology is where your understanding of all this will come in handy, but then you have to learn to distinguish amongst all the remedies. Without a solid basis, you cannot prescribe the remedy. Okay? Okay, so page 571. In tuberculosis, you find phosphorus indicated particularly in youths. And by this expression, I mean both young men and women who have grown too rapidly and have a delicate skin, long silky eyelashes, and who are of easy, graceful manners. The mental development is excellent, yet they have not the physique to support this keenness of mind. Particularly is it indicated if they have a hereditary tendency to consumption or have had a bone disease in early childhood. So this is the concept of anamnesis in prescribing. The patient catches cold easily, suffers from rush of blood to the chest. He has the above mentioned constriction across the chest with every little cold. Pains through the apex of the left lung, cannot lie on the left side. Aphonia. Pains on the apex of left lung, and this is how it is similar to sulfur also. Now, phosphorus and sulfur are generally considered quite similar remedies. Both are indicated in tubercular diathesis. Both have a very strong feature of burning. And the very interesting aspect is that when a phosphorus patient perspires, sometimes their sweat smells like sulfur. Aphonia, dry jaw, hectic flush of the cheeks, particularly towards evening, oppression of the chest at night, forcing him to sit up, empty feeling at pit of the stomach, particularly in the forenoon at 10 or 11 o'clock. He awakens hungry at night, feeling that he must eat and that he would faint if he would not. That's another feature of sulfur. Okay? So these are all the generalities of phosphorus that he's laid out for us at one place. So unless you give the drug cautiously, you precipitate what you would prevent. Be certain that it is the remedy and do not give it too often, or you will hasten the process you are anxious to avoid. I would not advise you to give phosphorus in well-marked tuberculous patients. If tubercles had been deposited You should hesitate before giving it unless the picture calling for it is so strong that you cannot possibly make a mistake. And some very learned people, like some of your teachers, because this is something you learn, that it was the prescription of phosphorus which gave Gyan his first observation, a prolonged activation and final decline of the patient. So in a very advanced pathological condition, when he prescribed phosphorus in a very high potency, there was a prolonged activation and the patient died eventually. Now, some may seem it is brutal, but it takes the courage of a physician to explain his failure in the very first observation. How he prescribed phosphorus in a patient who had very advanced pathological condition. There was such a strong activation and he gave it too high. So it eventually led to the decline of the patient and he lost the patient. That's why it became his first observation in the chapter called Prognosis after observing the action of the remedy or the effect of the remedy. I may say that the same is also true for sulfur. Sulfur is adapted to the onset of the disease. A dose or two allowed to act will frequently head these symptoms off. But after tubercles have been deposited, you must be careful about how you use it. What you basically is saying is, as long as the changes are functional, you can give the remedy. But once the pathology develops, you have to be very cautious in prescribing. Why? Because a lot of symptoms are common symptoms of the disease then. Now these common symptoms of the disease match with the common symptoms of the remedy. The prescription in such cases has to be based on more dynamic concomitants. What are the indications? Okay, so knowledge of disease, indication. If your prescription is based on indication and if you do not give very high a potency, you give a moderate, appropriate dose depending on the vitality. Preferably in the later years, we have the concept of LM potency. So use them, they'll act far more judiciously. But your choice of prescription has to be very, very careful in advanced pathological cases. Phosphorus on the heart is particularly indicated in infections where the symptoms of the right side of the heart is involved more than the left. What do you mean by right side of the heart? For instance, it is suited to all forms of palpitation, palpitation from emotion as from sudden entrance into the room of an unexpected visitor, welcome or unwelcome, palpitations from motion, also rush of blood to the chest. Particularly, does this latter occur in rapidly growing young men? Phosphorus must also be remembered in endocarditis, particularly when endocarditis or myocarditis occurs during the course of acute inflammatory rheumatism or during pneumonia. Phosphorus acts upon the bones. We find this illustrated in the necrosis of the lower jaw, particularly as the fumes of phosphorus cause necrosis of the lower and sometimes of the upper jaw. The concomitant symptoms help you decide on the choice of the remedy. For instance, the person is of the characteristic phosphorus build. There is diarrhea versus the morning, much like that of sulfur, the stool containing undigested food. There is tendency to involvement of the lungs. Patient catches cold easily. Marked tendency for bronchitis, etc., etc. So what happens is, a lot of times you find in your practice, especially in middle-aged people or in the elderly people, that people go to their dentist and they do an X-ray, an OPG or something, and they say you've got demineralization of your jaw bones. Okay, it's a very common finding. Now, there's a trend, people tend to prescribe for many remedies in our clinical practice very commonly. For instance, people prescribe Hekla lava very often in such patients, or people prescribe phosphorus in such patients. I've seen a lot of people prescribe calcarea fluor or calcarea phos in other remedies. But remember, whenever there is demineralization, it always pertains to the category of a constitutional disease. The indicated defecting remedy is the best remedy if there is a diet which is deficient in calcium intake, or if there is a constitutional trait because of which, even though the diet rich in calcium is not being absorbed properly, it can only be relieved and remedied by a defecting constitutional remedy. Okay? Phosphorus may be indicated, but only if the constitutional symptoms agree. It is likewise with Hekla lava. The biggest challenge to homeopathy is there is no one remedy that will be serviceable in all conditions. Okay? So you always have to differentiate and prescribe.
So in cases of demineralization, you have just said, we read within medicine the calcium metabolism is being maintained by the parathyroid hormone. So there is a book called the glandular medicine also. So should we think of those medicines? No.
No. Our prescription will always be on the basis of the personality or the total constitutional.
सर बहुत मेडिसिन कॉन्स्टिट्यूशन ही नहीं है.
So what is the use of those medicines?
For instance.
Parathyroid.
So what happens is, there are certain remedies which have been added to a Medica. For instance, Hekla lava. For instance, that remedy has never obtained a clinical proving at all. It was purely an empirical use by a certain doctor who was not really practicing homeopathy, but he experienced some results with a certain remedy in some of his patients, and that data was incorporated into the Medica by people like Burnett or R.T. Cooper or John Henry Clark. Okay? And they prescribed that in some patients, not in all the patients. Unfortunately, that has biased us towards the use of the remedy without any logical reasoning, because there's been no thorough proving. Think about it, ma'am. Why would somebody have demineralization only in the lower jaw? Why not in the rest of the body? This is your peculiar predisposition, that only one particular bone is affected. Like, if somebody starts with osteoarthritis only in the right knee, you say, okay, the person is right-handed. But right-handed does not mean that he'll always use the right leg more.
No.
They will be using both the legs. Why is somebody only manifesting in the right knee or right ankle or left hip joint or right shoulder or upper lid of the eye? It is always, you have to understand, it's not what we call the location. There is something bigger than that, it's called localization. The disease is first manifesting there, but the affectation is deep within. The prescription has to be on that affectation deep within. So you remove that symptom, it will come up in another part. So this is what happens, for instance, in people who are suffering with rheumatoid arthritis. One joint becomes comfortable after an anti-inflammatory drug, or because you give Brivia or stock, the other joint will start affecting after some time. So you have to take care of that tendency. Phosphorus also affects the joints, the hip and the knee joints in particular. Phosphorus belongs with silica and seems to complement it. It is useful when silica has been successful in these joint diseases. Fistulae in the glands and about the joints are apt to form with phosphorus. These fistulous ulcers have high edges from the exuberant granulations, the purulent discharge being rather thin and ichorous. Around the ulcer, phosphorus has probably more than silica and erysipelatous blush, often radiating as in belladonna. There frequently will be burning, stinging pains, well-marked hectic fever with night sweats, diarrhea, and anxiety towards morning. Now, phosphorus on the eye, it may not do best heavily for affections of the external parts of the eye. It certainly does lead the list for diseases involving the deeper structures of that organ, as the retina, choroid, and vitreous humor. Particularly in nervous affections of the eye, you will find phosphorus indicated. Vision is greatly lessened. The patient sees all sorts of abnormal colors, black spots in air, grey veils over things. It seems as if he were constantly looking through a mist or fog. Objects look red, letters appear red when reading. This is what you have to keep in mind. Objects appear red. This is singular to phosphorus. Other remedies have red vision, but under phosphorus alone it is that in reading the letter goes red. It's singular to phosphorus. It may also be indicated in retinitis with suppression of menses or some other uterine or ovarian disorder. Remember, दोस्त ये खास तौर पर आपके लिए. Remember that the lesion in the eye may have as a starting point disease in some other part of the body. Therefore, in making your prescription, do not forget to look for the constitutional symptoms that may be present. आपके brother ने इसलिए totality को prescribing किया. Okay, remember, it's not the location. It is the manifestation. Why would a drug manifest in some part of the body? That is also a constitutional feature.
Sir, in diabetic retinopathy, this is a very good medicine.
Very true, ma'am. Very
And
true.
optic nerve involvement, optic nerve.
Very true. When other symptoms
Symptoms.
vary. And especially, I would like you to remember the last two lines of page 574. Phosphorus is useful in amblyopia occurring after typhoid fever, sexual excesses, or loss of fluids. It is also suited to blindness after lightning stroke. In these cases, the patient almost always sees a green halo around the candlelight. A green halo. Okay? So in provings of phosphorus, you'll find all possible varieties of color in the eye. Okay, black, grey, red, green. Okay? And especially when we find some patients who suffered with an episode of typhoid fever, and after that, their vision became weak. Phosphorus can remedy that. And because phosphorus is so sensitive to atmospheric changes, and there was a patient, so in literature you actually find published a case where somebody was struck by lightning, and after that the vision got affected, and he had other features of tubercular diseases and other features of phosphorus, so he received phosphorus and his vision improved. That's how ultimately you find it is one of the remedies which can remedy the bad effects of electricity. That's how it came about, because the lightning strike is actually a large electrical impulse which passes through your body. So that's how it is considered as an important remedy, only on the basis of one patient who was cured. It found its way into the into the repertory, but it's actually an incorrect way of adding it to the repertory. Okay?
तो वेल्डिंग वगैरह करते हैं उनके भी न्यूट्रिशन आ सकता है नहीं?
So, yes, if required, yes, if other symptoms agree. So in the next class, we will start studying Antin crude next year. Thank you so much. Thank you.